Sorry, I said a minute, but we're going to cut that minute a little short. So yeah, I'm Jason Larson, Executive Director of St. Clare Health Mission. Perfect. No, I'm good. There we go. Perfect. All right. Should we do it a third time or should I just go? I'm just going to launch in, everyone. So we're going to talk today. It's a little more maybe clunky of a presentation than I'd usually give because there's a lot of information that we want to give to you about our programming and our organization. I want to talk a bit about the capital campaign, but was also really invited here to talk about what we're seeing and what we think we're going to see over the next couple of years with the huge kind of changes right now in the healthcare landscape and really in the landscape that serves kind of marginalized communities. So we're going to do all of that and really want to start with how this all began. Whether it's Sandy, who's pictured there, or me, we really owe St. Clare Health Mission and these incredible partnerships and the way it works to Sister Clare. So really started the Indo-Chinese screening clinic in the 80s. Lots of folks in the room remember when we brought a lot of Hmong refugees to our region that weren't faring well after we left in Vietnam and brought the refugees over. Sister Clare always wanted to minister healthcare to the poor and started a free clinic to have a soft landing to healthcare for the Hmong refugees as they arrived. And that really was the precursor to what is now St. Clare Health Mission. So that operated for a little over 10 years, and there was a huge recognition at that time that we really need a free clinic that supports not just one group of people, but really supports all of the folks that are uninsured and can't find a way to healthcare. What's incredibly unique about St. Clare Health Mission, even nationally among free clinics, is when it started with the full support of what was then Franciscan, Skemp Clinic, Gunderson, and Lutheran Hospital. So all four came together with FSPA to start St. Clare Health Mission. And fast forward 33 years later, now as an independent 501c3, our board designation is 3 reps from Mayo, 3 reps from Amplify, 1 from FSPA, and 1 at large. So even 33 years later, we have those relationships and connection. So when we're looking for volunteers and different partnerships and service, it's not this weird executive director guy asking. It's, VPs like Dr. Bentz and folks within the system saying, hey, this is how we could really improve care for the community. Joe Durst on the left, did I click it? Also, just all the folks, and there's a quote from Joe Cruz. Peter Grabo wrote the original press release for St. Clare Health Mission over 33 years ago, so just a rich history in this community. Not part of the presentation. I never met Joe Durst, but when I was looking him up, Dr. Durst was also a B-2 bomber pilot and instructor during World War II. And we've been operating, Sister Clare was able to really kind of fulfill her wish of ministering healthcare to the poor right across the street from FSPA. This is our current clinic, 916 Ferry Street, and we've operated out of that clinic from the beginning for all 33 years. Was anyone in this room there other than this table in the early days? So some hands raised. And if I gave you a tour of St. Clare Health Mission 33 years later, it's exactly the same. So we're due. And we'll talk about that as we go through. I mentioned the partnerships. Again, those are so important because healthcare doesn't happen in a silo, and for this group of people, it can't. And so the partnerships, when someone needs care that kind of goes beyond our walls, we have partnership where they can receive that care at both institutions at no cost to the patient, as long as they income qualify. Who we serve. So I think should I just, because it's kind of going off mic every once in a while. So I think there's some misconceptions about who we serve because I think we get in the news so often for mobile medicine and some of the unsheltered work, which is hugely important, but over 95% of our patient population are not those folks. If you make under 100, 200% of the poverty line, in Wisconsin, you get really great insurance through Badger Care. And it's good insurance. If you make, say, literally $9 an hour, or $15, $16 an hour, maybe you make $20 an hour, but you have a child or 2 children, you don't qualify for any subsidies or any health care in Wisconsin. That's our bread and butter. So we're 95% of the patient population we serve are folks you see in restaurants, on roofs, in house cleaning, and at farms, and at furniture factories, working their tail off. I would argue likely harder than most of us, including myself in this room, who have zero access to affordable healthcare or healthcare. That's our bread and butter of who we serve. You don't have to read all this. I'm just going to highlight a few things. So one of the things they really wanted me to communicate today was the just vastly changing healthcare landscape that we're going to see right now and over the next year or two. Most people aren't aware that already happened. So if you look, 194% increase in patient visits over 5 years. So during the COVID years, it was pretty bare bones for us. You know, didn't need a lot of volunteers. We didn't have a ton of patients. And everyone on Badger Care through the entirety of COVID was just kind of grandfathered in. They didn't get bumped off. They didn't have to submit paperwork. They didn't have to do anything. They just kept their Badger Care. When that lifted, everyone got essentially bounced off Badger Care. So they could reapply and still get it back. A lot of people didn't or couldn't because then their income got a little higher. So that was our first year of, I think it was a 42% increase in patient visits because of that first initial big shift, which kind of bounced a lot of folks off healthcare. So we, during COVID, could get away with, maybe 1-2 docs. As that shifted, we needed maybe 2-3, and now we're at the place where we try to have 3, but are working towards 3 or 4 we have at almost every clinic. So constantly working to recruit volunteers. And then COVID, it's unusual that people are in the room that I talk about when I'm speaking, and some of the folks are here, and a few aren't here that I'll still mention because they're members, but so I have all business degrees, like marketing and an MBA and no healthcare background. And then I was invited to take over St. Clare Health Mission and started February 4th of 2020. And about 3 weeks later, the world shut down. And so I didn't know Dr. Bintz very well. I didn't know Peter very well, intimidated by both of them. And we got on a quick call to see, what do we do? Everything's shutting down, everyone's terrified, and the world's shutting down. And it was under 5 minutes that Dr. Bintz and Peter Grabo decided, this is the population of people that need us the most and that is gonna have no access. So we're gonna remain fully open during COVID. So though I was slightly terrified at the time, it was a real heartwarming start to St. Clare Health Mission to see that the board really cares about what we're doing here. And those are some of our volunteers and staff from that era. And then again, as COVID kind of lifted, everything shifted. So we could get away during COVID, because of the age of a lot of our volunteers, I became a phlebotomist and could draw blood. And we really got kind of through as a bare bones clinic. And then everything shifted and our numbers increased so much that we are constantly recruiting more volunteers. This is what a typical clinic volunteer night looks like. We have CNAs, we have lab, we have social work, we have interpreters, docs, med students, residents, students from UWL, students from Viterbo, students from Western, all coming together as volunteers to serve the poor and uninsured. Rotary Mobile Clinic. So this is, really I was hired. The thing that made me so excited to take this position was in the interview process, Dr. Bintz had said, we're not asking you to come here and run a 2-night-a-week clinic, as St. Clare has been for the last 30 some years. We're asking you to take St. Clare Health Mission and kind of the value of it outside St. Clare Health Mission walls. As a lot of you in the room know, it was really Josh Mancy during that dark time of COVID when we all just felt like it was almost like a global depression and there was a lot of fear. Rotary and Josh Mancy had the idea, why don't we do a big project? Why don't we get all the Rotary clubs together and do a big project of kind of hope and to inspire the community. And they invited, I think, 7 folks in to submit proposals. They invited 3 back. to make kind of in-person proposals. And again, it's funny that one of the people is here. I'm going to look at them. But so I came in to give my proposal, and I'm a Rotarian. So I sat down, and some of the heavies in this community were all giving their proposal. And so my heart just sank. And some of them are here right now because I knew they're going to win. We're not going to win this. And then I said to someone, like, I think I'm not supposed to be in here. I'm a Rotarian, but I'm presenting next. And they said, oh yeah, you shouldn't be in here. So then they walked me back out to the waiting room. But I think the whole Rotarian idea around the Rotary Mobile Clinic is this. You know, how many in this room as Rotarians have went to another country to provide service to marginalized communities? Raise your hand. And so a lot of you. And so many of us do service here. A lot of the things we go to other countries to do, we need here now. And that was really the sell around the Rotary Mobile Clinic. There's a huge need for this during COVID, after COVID. And they think with all the Medicare in rural changes right now, it's just going to boom even more and more. This picture, if you really look at it, is what's called a cartoonified picture. So this is a real photograph. And this was one of our sport physical nights on Rotary Mobile, where you pull up, everyone signs in, gets ready, we have nurses stations, and then they go on to the unit for the sport physical medical exam. We've been operating this program for over 3 years. On Wednesdays, we serve the unsheltered locally, typically go to Catholic Charities and then Salvation Army, and then find folks where they're kind of congregating when we have encampments and not encampments, and work to really, that's that population that has insurance, but working with the health systems that we want to scale folks back to health. So essentially, if you're unsheltered, maybe you have a substance abuse or mental health problem, living on the streets, you know, diabetes, hypertension, mental illness goes to like 4, 5, 6 on that list of concerns for you. So this is a way to go meet folks where they're at and try to help slowly but surely scale them back up to health. And then on Fridays, the Rotary Mobile Clinic goes to rural areas. So we go to farms in kind of a 45-minute hour radius. We go to schools often, and we have partnerships where we just roll up and the patients know we're going to be there, and we serve that population where they work and live. And then lastly, as far as the program, or not lastly, second to last, the community health worker program. So we've been doing this in different versions for about 5 years, and now we're really expanding that. We did, probably 3 years ago now, we did a kind of a test run with Gunderson Health System where we thought, what would happen if we placed a community health worker in the ER to work with patients that are struggling beyond health? You know, maybe it's, again, addiction, mental illness, poverty. And what it showed was after 6 months, that individual community health worker offset over $600,000 of high ER costs. I always say, like, I know there's a lot of nonprofit puffery. I didn't run those numbers, Amplify Health did. So saw just a huge cost savings by having that, then expanded the program both within Amplify and now Mayo. And we have, I think right now, 6 community health workers. Some are embedded within Amplify, 1 at Mayo, 1 on the Rotary Mobile Clinic, and are currently expanding for more and more. The State of Wisconsin Free Clinic Association is modeling this at the state level with other free clinics and institutions. And Mayo is kind of using this for their enterprise-wide idea because it's working so well to have a contracted outside employee doing this work within the health system walls. And I think a lot of the reason the big systems can't do that as effectively is because they have really good attorneys and they don't want folks kind of transporting people. So it's great for the free clinics. It really builds health for a population that's struggling, and it's just a great partnership. I'm going to say one more thing, even though I don't think Richard is here today. Is that true? We'll go back to clinic pictures. So Richard Strauss volunteers with us so often that he doesn't sign up to volunteer. He literally texts us if he won't be there. And I think there are a lot of people that know my personality a bit in here. My favorite Richard Strauss story, and you can like look at these young women, is a perfect example. I had asked Richard, who interprets for us, so he only interprets for us. I had asked him, I couldn't get the blood out of someone, the veins just weren't right for me, so I asked if he could do it. And I'm walking by with Richard, and I can hear one of our young volunteers say, now he just asked the interpreter to draw blood. People that know me know I have that kind of personality, so then I said, Richard's like the humblest guy we'll ever meet. He's also a doctor. And I'd say most of our volunteers that have been with us for under 2 years have no idea he's a doctor, because as you all know, he's just not that guy to talk about it. Mental health programs and therapy. So when I started, we had a clinic coordinator that helped out in that capacity and a social worker. And when that social worker transitioned out, saw just a huge need for therapy, as we all know, for mental health counseling. So we shifted that position into a full-time mental health therapist. And over time, do the individual therapy, the one-on-one. Over time, developed more group therapy for different groups of people. And then she was being trained as a coach to do more of kind of the coaching, a thing we want to see at St. Clair Health Mission for all of our patient population. But specifically the folks that are really struggling is, I think, so much in nonprofit and social services. What we do is we take a whole population of struggling people, our clients one-on-one, and say, like, how could we help you get back to okay in a way that's unsustainable, unaffordable, not real happiness, but like you have a place to stay, you've got a little food. And I think a lot of times that's backwards. And I think to flip that, what we want to do is more talk to these clients and say, like, a year or two from now, if you were really happy, what would that look like? What would that feel like? Where would you live? What would you do? And so you're starting with a client from an aspirational goal of what would that look like. And I think for a lot of people, it's, gosh, I could just make rent every month, I'd have food, maybe a little money for fun. And so you're helping someone go towards something instead of away from something. And then on the right is our newer therapist, Shaylin. On the left is a stock photo. And more we're getting into doing groups, what I would call like polyvagal therapy, if people have heard of that, somatics. I think the most simple way to explain it is there's a whole population of people with high kind of trauma or ACEs scores that have never felt safe. And for the folks in this room, there are a lot that can probably relate to that and a lot that can't. And when you have a high trauma, like safety and feeling comfortable in your own skin just was never there, co-regulation, nervous system regulation. So we trialed probably 2 years ago, the first group of that. And of the participants, there were probably 11, 12 of us. And at the end of that 6-week group, just kind of teaching people to connect back with themselves, feel safe and embodied. Here in this moment, most of them teared up at the end, so thankful. And again, oddly, for Leah Tanke, who is here in this room, she's the instructor and our partner in this work, literally cried. Men and women cried. I teared up a little bit because in 6 weeks, I learned how to connect with myself a different way so deeply that it naturally is a healing process. So really fortunate that we got a $130,000 grant to continue this work. So kind of phase 1, 2, and 3, right now we're running a group at FSPA, and the goal is to train a lot of service providers first, because you can only give away what you have. And so right now we're training, I hope we get them all right, our community health workers, Hmong Cultural Agency, Driftless Recovery Services, Catholic Charities, Unity House. And the goal is to train a lot of direct service providers and then take these groups into their nonprofits and teach this work to clients. And then there's a phase 2 and 3 of that. But I think for myself personally, with kind of a high trauma history, some of this work has been the most profound changes in my life. And you can think of it as a lot of us are succeeding, and I think we all know this, a lot of us succeed and do good work because it's easier than navigating the complexity in trauma of our own lives. A lot of us are doing good things and good work because we're embodied and that's who we are and want to move forward with that. That work might look the same on the outside, but there are huge differences. And so I think it's really important to train and teach a lot of people to be able to do that in this work. The next part is really the capital campaign, which Marianne did such a good job explaining, so I'll just go through that more quickly, but we can take questions as well. So I think in this work, there are so many things that it just feels like synchronicities in that it's just gonna happen. So we were working for a few years with Mayo really positively to find a spot to build a new clinic. And all that work was going really well with 360, with Mayo, with FSPA, with some other partners. And then as they do every 3 to 5 years intentionally, the leadership changed. And so we knew in some ways it was gonna happen, but we were kind of at square one. And so during that time, this clinic opened up. I had talked to the guys at Borton, and they said, yeah, it's gonna be so much cheaper for you to build onto something already existing than to start new. We talked to Mayo. They said, we're decommissioning the breast center and moving that so you could get all of this incredible furniture, casework, cabinets, fixtures for free and move that there. And then, as she mentioned, the financial support came and we purchased the building. We had two kind of thoughts on a capital campaign, 3.2 million. We're a Franciscan organization, kind of stewardship and service, and we don't need a Taj Mahal, we need a really great clinic to serve people. So we went with the lower goal, knowing that there were more needs. And heard from John Lickey, he, involved in dozens of capital campaigns. I think because of what St. Clair Health Mission is, because of who it serves, it was one of the fastest capital campaigns you've ever seen, 7 months from kind of start to completion. And everyone sitting in this room knows also, we know the timing, this is a huge need and it's gonna become more of a gargantuan need. So we're so thankful that we're able to meet the moment. And then it's updated now, but that's really what the clinic will look like. So 406 Jackson Street, the old Bent's Chiropractic, and what they've done is additions on both sides. And this really does a lot of things for us. Oftentimes we have 2 or 3 or 4 people in a clinic room, so these are sized so that they can handle that. 3 or 4 of these clinic rooms will double as offices during the day. There'll be shared offices for both the clinical staff and the community health worker staff, and just all the things that are needed in kind of 2026 for the kind of work we do and in the kind of folks we can support. I'm so bad at the clicker today. And so, yeah, that's it. With that, I'll open it up to questions.
Great. So we have time for about 1 or 2 questions. Anyone? Nikki, do you want to bring that to, I think, yeah, right behind you.
Thank you. This is wonderful, and I appreciate the work that you do as we work closely. Question about dental. Do you offer dental?
I'm so sorry, RJ. So it's a yes and no. So we don't provide dental services ourselves, but for years, from the Joe Cotner times at Cooley Dental and now RJ, we have dental partners that partner with us for this work. So and are very gracious with how much they charge us. So if the patient can pay, they pay. If the patient can't pay, then we'll pay that. And we partner with RJ at Cooley Family Dental and Scenic Bluffs, FQHC. So we do a lot of dental work, though we don't do it ourselves.
I just wanted to say thank you for that because I think it's really important. It's Carolyn talking. And so Jason, because I was that person. So I was working hard. I couldn't get insurance. I couldn't do those things. And I had a chipped tooth. I'd only been to the dentist once in my entire life. And I had a front chipped tooth and I couldn't get it fixed and I couldn't find anyone. And there's one dentist that supported me and it changed my life. It changed the ability for me to smile, to get a job, feel confident. And so this is such important work. I just want to say thank you. And thank you to the partnerships that you've created.
Thank you. And thank you, Archie.
Hi, Lauren. Jason, appreciate all the work you do in the community. I'm wondering, with the way the world currently is and the impact happening to immigrant and refugee populations, are you seeing that it's more difficult to find folks, or because you're so embedded and connected to those communities already, is St. Clair Health Mission a safe space for folks to go to and you're not really seeing an impact? What's that look like?
Yeah, that's a great question. And honestly, I think I can speak for the board and staff and myself. We don't always know how to even answer these kind of questions or touch them right now, but um, I'll make it as short as I can. So 20 years ago, there were 2 Latino families in the Arcadia School District. Now it's over 85, 90%. So we've had this big boom and the world shifted and we needed it to shift because we need the workers. I will say that after the last election, politics aside, we had our first, and I get choked up like saying this honestly, but we had our first mobile clinic that there were no patients. I'm going to take a deep breath because it does affect me emotionally. After the murders in Minneapolis, our patient numbers dropped to below half of what they consistently are, and then slowly but surely bounced back up. So we're an incredibly trusted partner with all of the people we serve, but that doesn't always make it safe to get from A to B. And so we're seeing, and we've also heard from good sources that folks are probably safe in this area, but nobody knows. And fear, it creates a lot of fear when these things are happening, 2 hours away. So it's kind of been, as it has for everyone, just a lot of ups and downs over the last year. And we communicate through text and various means and through partners in different areas that, always welcome. And we're continuing to figure out different ways to deliver service, whether it's mobile or telehealth, and kind of shifting how we support folks that are sometimes feeling afraid to come.
Well, thank you, Jason. We really appreciate you being here today. Our club has a small token of our appreciation for you. Thanks for helping us unite for good in our community, and certainly to our board members and those who are here. We really, really appreciate you touching and helping create safety physically, emotionally, and mentally for those in our midst. So